alaikum wa rahmatullahi ta'ala wa barakatuh. Welcome back to my YouTube channel. I am Dr. Dada, and today, inshallah, we are going to continue with the most common G.I.T presentations, which is the part 3. And I'm going to tell you more about vomiting. So let's dive in and see. Now, vomiting. What is this vomiting? Vomiting is a forceful ejection of gastric contents to mouth. It's the forceful ejection of gastric contents through the mouth, and it's very important for you to differentiate between vomiting and regurgitation. Now, like I said, vomiting is the forceful ejection of gastric contents through the mouth, while regurgitation is what? The backward flow of gastric contents into the throat. So you see this one, it's outside and goes, when you vomit, the content goes outside of your mouth, and when you regurgitate, it comes to your throat. Now, what are the causes of this vomiting? Causes. We have alcohol. Yeah. We have psychogenic, and some infections like the gastroenteritis, UTIs, hepatitis, and we have gastroduodenal problems like what? The peptic ulcer, the gastric cancer, the gastroparesis, the acute infection, and the rest. And there is also intestinal obstruction. And then we have metabolic causes, things like the DKA, diabetic ketoacidosis, and we have also drugs, example like the NSAIDs, the antibiotics, and the rest. And we have the CNS causes, which are things like things that raise the intracranial pressure, like meningitis, and we have things like migraine and the rest. And we have toxins too. So now, what is the pathogenesis of this disease? Pathogenesis of vomiting. So there are like 3 phases of this pathogenesis. We have, it starts from nausea, then retching, which is like involuntary effort to vomit, and then finally the vomiting itself. So now, what causes these 3 phases of vomiting? Okay, what happens is there will be what? Contraction of these 3 things, which are the diaphragm, the intercostal muscles, and the abdominal muscles. And all of this contraction of all of these muscles would lead to what? Increase intra-abdominal pressure. which will lead to what? Relaxation of lower esophageal sphincter, and this will lead to finally the vomiting, which is the forceful ejection of the gastric content. Vomiting, finally. Now, what are the complications of vomiting? Complications of vomiting. We have dehydration and hypokalemia, aspiration, and we have rupture of esophagus. We also have the Mallory Weiss syndrome, and finally the metabolic alkalosis. Now, how do we investigate patients with vomiting? You do blood tests, ABGs, you do X-ray, endoscopy, head CT, and so many more. It just depends on the symptoms and complaints of the patient. Then you choose the best one to do. And how do you manage patients with presenting with vomiting? The first thing to do is you rehydrate the patient. Rehydrate the patient. You can give antiemetics depending on the type of vomiting, and you can treat according to cause afterwards. According to, I was thinking of something. To cause. The best thing to do first is the rehydration. It's very, very important. So this brings us to the end of today's lecture. Thank you. Like, share, and subscribe. Yes. Yeah.